Hello, I'm Kate Crisp with Mighty Oak Technology, pleased to announce our latest product, QIK, the Quality Initiative Kiosk. Initially, a patient will be asked to input their first and last name, date of birth, and zip code to confirm their identity. They will then click the Login button. Next, the patient is prompted to fill out the cheif complaint form by clicking on Cheif Complaint. They are shown what they stated at their last encounter and are then allowed to enter the reason for their visit today. As we go through, watch how the patient can click to describe their pain intensity. They are prompted to describe the frequency and current state of their complaint, whether it be improving, staying the same, or worsening. As we move on, the patient is prompted to indicate the areas where the pain is experienced, both in the back, neck, and extremities. In our example today, Andrea Anderson is coming in for pain in her lower back, right hip, and right buttock. The patient is then prompted to indicate their pain level on a visual analog scale. Finally, the patient is asked to indicate how their problem is affecting their activities of daily living. When finished, the patient will be asked to electronically sign and click Accept. After the daily encounter notes, the patient is prompted to fill out any functional assessment forms the provider had assigned for them in ChartTalk. In this demonstration, we will be using the Low Back Disability Index form. You may recognize the standard form used here. QIK will walk the patient through the functional assessment step by step and score and store the form in ChartTalk automatically. QIK is used to easily gather the subjective complaint of a patient on a per-visit basis, as well as consistently and accurately deliver various outcome assessment tools, which are then automatically uploaded into ChartTalk, as well as scored and graphed for analysis. QIK was built to help providers participate in various quality reporting programs, such as PQRS and the NCQA's Low Back Pain Recognition Program. Watch as the Low Back Disability Index form is completed. I will then show you how this data is then imported and reported into ChartTalk. Let's take a look at how this information comes into ChartTalk. First, we'll look at the daily SOAP note. As you see, all the information that Andrea entered herself through QIK automatically populates the subjective portion of the SOAP note. Of particular interest, the Low Back Disability Index score is reported, as well as the delta value from the previous functional assessment form that the patient has completed. Next, let's look at what's brought into the Documents portion of ChartTalk. Any functional assessments scheduled to be delivered appear at the top of the patient's chart. Let's take a look at the most recent Low Back Disability Index. Here we have a printable record with all of the patient's answers to the questionnaire. Selecting any of the data document types will show you a graph of how the functional assessments have been scored over time, allowing you to make clinical decisions based on this data. We are very proud to present QIK and ChartTalk 2012,